Hi friends. Welcome to Dentistry Love channel. Aim of splinting and types of splints. Aims of splinting. To stabilize the tooth are teeth that have been loosened, repositioned, replanted or fractured and maintain its/their position throughout the splinting period. To optimize healing outcomes for the pulp and or the periodontal ligament. To improve function and provide comfort. Types of splints. Based on mobility degree. Based on duration of use. Based on mobility degree. Semi-rigid, rigid and flexible. Semi-rigid. Composite resin and steel wire with a diameter from 0.015 to 0.030. Can be placed after tooth avulsion of the incisors. The use of semi-rigid splint is more indicated than the rigid one, and that long periods of splinting showed that substitutive resorption or ankylosis is an expected complication. Rigid. In cases of fractured bone plate, a rigid contention is necessary and suggests the use of Eric bars and braces. It can be placed after tooth intrusion of an upper left central incisor. At the moment of the consult, the patient reported to be using this splint for 2 months. It was revived immediately. After CBCT, it was possible to confirm the substitutive resorption on the root of the tooth. Disadvantage includes substitutive resorption and ankylosis. Flexible and short-term splints allow the physiological mobility of the teeth, which has been proven to be in favor of periodontal healing and reduce the risk of ankylosis and external resorption. Example includes the use of nylon monofilament 20 to 30 pounds. There are many different types of splints, some of which are listed. Composite and wire splints. The wire is secured to teeth with composite resin. In case of avulsion, permanent retainer. Composite and fishing line splints. This is where a fishing line replaces the wire, used in traumatized conditions. Orthodontic wire and bracket splints. Orthodontic brackets are bonded to teeth with an orthodontic cement and connected with an orthodontic wire. In case of avulsion, orthodontic tooth movement. Fiber splints. Usually a polyethylene or Kevlar fiber mesh bonded to teeth with an unfilled or composite resin. Suture splint stash. Suturing is required where there are multiple missing teeth or where conventional splinting is not possible. Titanium trauma splint. The flexible titanium trauma splint has a rhomboid mesh structure and is just 0.2 mm thick. It is secured to teeth with composite resin and provides superior qualities when used for splinting traumatized teeth. Arch bar splints. These consist of metal bars bent into the shape of the arch and fixed in place with ligature wires. In case of alveolar fractures, for splinting of traumatized teeth. Wire ligature splints. Wire is tied around contact points and interproximal areas to stabilize traumatized teeth. Vacuum-formed removable splints. It requires impression taking and preparation of models. An acrylic sheet is heated and drawn over the cast model under vacuum pressure to form the splint, which can be trimmed to fit. Example includes occlusal soft splints and clear retainer. Based on duration of use. Stabilization splint is an increase in resistance to applied force by providing reciprocal antagonisms and increasing the effective root area. The force may remain the same, but the resistance is increased. Temporary splint is used on a short-term basis, usually less than 6 months, and is often advocated to stabilize teeth during periodontal treatment. It may or may not lead to other types of splinting. Provisional splint is used for a longer period of time from several months to as long as several years. It is used for diagnostic purposes, allows the clinician to see how teeth will respond to treatment and leads to more permanent forms of stabilization. Permanent splint, also referred to as periodontal prosthesis, may be defined as those restorative and prosthetic endeavors that are indicated and essential in the total treatment of advanced periodontal disease. Thank you friends. Please do subscribe for more videos.